Okay, so stationary cupping, right? We're going to just drop it on, leave it. Now, we're going to watch our clock. I don't want you to leave this on for more than 2 to 3 minutes, okay? So we're just going to leave it on for about 30 seconds right now. So you can see the skin in there. It's raised up. It's turning a little bit red. I should use a clear cup. But all right, so we're going to take this off. And you can see a mark. The longer it's on, usually the deeper the mark gets. Yeah, but it's going to fade pretty quickly.
Yeah.
Like I said, it's not unusual for there to be a mark for anywhere between 2 and 10 days. So just beware. Now, if we're going to do a moving cup, we're going to place it, and we're going to move it along. Is it too much? Yeah,
There's a little sore there.
That's right. Yeah.
I think it's just crazy to think, like, just looking at it, it seems like it would just be affecting the skin, but it's just like showing how
Yeah,
it like really grabs that muscle and like.
All right, so here we're gonna do this, and we're gonna do that little bumping. So I've kind of come to a little spot of resistance. So I'm lifting up on the cup, and then as that becomes a little looser, I can move a little further, and then I'm gonna lift again. And I'm not, trying to yank this off her or anything. But I'm just holding.
When you're moving it, can you keep some, like,
yeah,
lift on
you
too?
can, yeah, sure. You could do, lift and move the whole way too.
Surprising how sore it's doing.
Yeah. Okay. And so then flutter cupping, we'd find a spot, right? And we put it on, take it off, put it on, take it off, put it on,
So
take
just
it off.
like the general area.
Yeah,
Like,
so that same sort of area. And it may be something that's real uncomfortable for someone,
Yeah.
so it won't sit there for a long period of time. So we're going to just put it on, take it up. Ooh, maybe. Take it off, take it off. There we go. And then do it again. Maybe it's staying there. I don't know.
Being a real good sport.
I just didn't expect it to be that sore.
Really.
Yeah. So stationary, we just pop it on and leave it. Moving, we put it on and we move. Okay. Then the lift and release, we're going to put it on. We're going to come to a restriction. We're going to put a little lift on the restriction. Now, some people do that. Like, who was it that said they had a bad knot on their scapula? Oh, it was Jessie. Okay. So you might find that knot on her scapula, put it there, and just lift for a minute. And then after that kind of lets go, you can lift a little bit more and then a little bit more and stay on that one knot. Okay. And then, like I said, the flutter cup is when we keep dropping onto the same spot and just holding pressure for, a quick.
So you're doing the same spot, or
15 seconds.
you're moving around a little bit in that same general spot?
In that same general spot. But yeah, we leave it on for just a minute, not a minute, a second, maybe 10 seconds, and then do it again. Okay. So 4 different ways. Now, with the vacuum cups, I don't like to move these around as much. We're just going to add that one pump. And here you can really see.
Yeah.
So we're not getting like crazy intense color.
Yeah.
It actually doesn't hurt as much as the silicone one.
Oh, cool.
Is there a reason for that? Or is it just Laura?
I think it's just Laura.
Cool.
But anyways, so then when we want to release this, we're going to just lift up on this center.
That's cool.
Okay.
Yeah.
All right. So, questions?
Can you do a purple one?
Sure.
That one says
Just
just
want a different color? Yeah.
No,
so
I just wanted to see
Oh,
that.
okay.
Okay.
Just pushing down with it.
Yeah,
Put it
and
on.
then you can move this too. Okay. That's pretty big for her, but yeah.
Does that hurt? Like,
Yes.
Yes, over there.
Yeah.
And that's bigger. It's covering more space, so. Yeah.
Oh.
Yep. Yeah, but this is like really nice along like the low back. Gastroc. You can kind of go up and down, like from the Achilles up to either side of gastroc. Nice. We were stripping the other day. Words. And so you could use cups to kind of do that same sort of thing. So, all right, ask me questions.